have a MDS degree in oral and maxillofacial pathology, and I have also pursued my PG diploma in clinical research and pharmacovigilance recently. So I work for this institute in Calcutta, AM Medical Center, where I am a general practitioner as well as consult oral pathology lesions as well. So today I would be talking about nanotechnology and bioprinting, the avant-garde of future dentistry. So what do we mean by avant-garde? So avant-garde means that apart from what we have known as the therapeutics, diagnostics, prognostics of dentistry since its inception, and what are the latest developments, the latest new experiments that has been on the row for quite some time now. So nanotechnology and bioprinting, although is getting more momentum nowadays, but the theoretical research has been on since the past very decade. So today I will be briefly elaborating on this topic, making it as simple and concise, discussing few journals as I have got across from the different scientific articles. So before I move on to the main topic, I would just roughly, give a brush up from, of dentistry since its evolution. So coming to the historical stages of dentistry. So as we know that since ancient time, it was purely extraction based. Okay. So then in the 17th century, Pierre Fauchard, who started the restoration and replacement based dentistry. In the 1949, fluoride treatment was introduced, which gave us a new light on prevention based dentistry. In the 1960s, we got introduced to the diagnostic based dentistry, where we could actually use the saliva of the patients to proper use, and we could be able to gauge the different genetical predisposition of the oral health of any individual, whether that person's susceptibility to oral cancer or any oral ulcer, or be it any susceptibility towards dental caries. Eventually, the concept of oral microbiome and regeneration dentistry came into being, which was introduced quite some time now, although it hasn't been a part of our regular clinical practice yet. But yes, as we all know that recently there was a study conducted in King's College London, where in a laboratory setup using dental follicular stem cells, a whole tooth was reconstructed from scratch. So although it is very in its inception stage, quite a lot of research is ongoing, we will try to cover up as much as we can in this short time. Now, before we proceed to the usage of nanotechnology in dentistry, what do we understand by nanotechnology? So basically, it's a field of science and engineering that deals with basically manipulating matter at atomic and molecular level, specifically at scales of 1 to 100. So it was coined by Eric Drexler, who was an American engineer, and we know that was denoted by 10 to the power minus 9 symbol. Now coming to its applications, so nanotechnology has potential to revolutionize various fields, which includes medicine, energy, electronics, material science, and more. So, and it usually involves top-down and bottom-up approaches, where top-down methods mean carving or etching material, while bottom-up means involving building structures from smaller components like materials or atoms. Now, it has a very promising impact to lead to new materials, technology, and product with enhanced properties and functionality. So here, these are the primary benefits that we get from nanotechnology. First, we get is increased chemical reactivity. Then we have optical activity and improved appearance. Then we have is improved solubility, structural integrity, increased surface area, and better dispersibility. And these are the different utility of nanotechnology. We have it in delivering, drug delivery at using nanomolecular level, physical sciences, as I have mentioned, electronics and nanofilters. Then we have food technology and biotechnology, engineering, cosmetics, and of course, tissue engineering. Now, so we will discuss this in a very, discussing different journals and the research that it has compiled. So first, this research was done in the year 2013. This is like one of the primary research which is available in Google Scholar. This was done by Mungara J. et al. And they have conducted basically a research using the unpaired t-test, where they have used both pre-reacted glass ionomer and nano-ionomeric glass ionomer, where they have incorporated nanoparticles. So they have studied the usage of these two types of ionomers in two groups of patients, and they have identified their p-value over a period of, as you can see, 3 weeks, from day 1 to day 21. And in both the cases, using both PRG composite, that is pre-reacted composite, and nano-ionomeric, always the p-value was found to be eventually less than 0.005, which actually meant that nano-ionomeric glass ionomer was much more efficient as a dental restorative material because of its increased chemical reactivity, better bonding, and better retention of the restorative material in the long run. And of course, the fluoride release from nano-ionomeric glass ionomer restoration cement was quite a lot more than the pre-reacted composite glass ionomer cement. Now coming to its utility in nanoendodontics, this was a study conducted in 2022 by Ozdemir et al., where they have identified the usage of nanoparticles in different aspects of our routine endodontics, whether be it in tissue regeneration, where we are treating a necrosed pulp root canal complex, structure testing in case of restoration, dental restoration, mixing nanoparticles in our routine irrigation, or for our root canal sealers, whether in terms of operation or in the form of intracanal medicament, when we have placed this calcium-based intracanal medicaments for betterment of our root canal procedures. So eventually the authors found out that in each and every step of a root canal procedure, nanoparticles, infusing nanoparticles, these bioactive glass particles, they have magnified the usual properties of these chemicals and have given a lot more predictable result and sustainable results. Now, these are the different materials which was incorporated, as I mentioned. Among the organic ones, this is from the very same article actually. So from the organic nanomaterials, they have included graphene, chirlosan, polylactic coglycolic acid, and the inorganic ones you can see as bioactive glass, as I've told, silicon dioxide. Then we have hydroxyapatite, which obviously, as we know, helps in structural integrity as it helps in remineralization. Then we have silver compounds, metal oxides, like in zirconia, titanium, magnesium oxide. So all these nanomaterials were incorporated in routine endodontics, and significant remarkable improvement were seen since their surface reactivity went up, their retention bettered, the sustainability and the prognosis of the treatment were quite amplified as well. Now, they have actually this is like just one of the this 3-4 studies I have taken up, which was quoted from the same journal. So here in the first time, it's Sagiri et al. They conducted a nano modification of MT, as we know, the mineral trioxide aggregate. So they tested for the setting time and the micro hardness. Then Akbari et al. They tested nanosilica on the setting time and physical properties of MTA, where they mixed, added nanosilica to the MTA, usual MTA, mixing with water. They tested with and compared with pure MTA. So these are the different studies which has been ongoing since like more than a decade now, actually. So now, as I mentioned, that I was talking about top-up approach and bottom-up approach when I was in my initial slide. So basically, this illustrates the synthesis approach, which is used in nanotechnology, and how these approaches can be explored for manufacturing a tally of nanodental product, where bottom-up and top-down approaches are the most commonly used practice for constructing nanodentistry product. The biomimetic approach is still in the research phase. Hence, primarily what we see here is the bottom-up and the top-up approach, where the bottom-up approach is applied in mostly crystallization, polymerization procedures, from where we get the nanocomposite, nano encapsulation, prosthetic implants, bone replacement material, nano needle. Then in top-up, we get is mostly in the emulsification it is used, homogenization used, milling for dental prosthetics it is used. We get that in nano dental anesthesia, oral cancer diagnosis, treating hypersensitivity, and of course it's the most, these bottom up and the top up are the most conventionally used practice. Now coming to functional approach, this mostly deals with antimicrobial medicine, which is very niche actually, and usually deals with the different nutrient supplements. So primarily functional approach deals with the drug delivery part mostly, and biomimetic is basically still a futuristic approach, still under the wraps and undergoing research is going on, because generating generating a material which absolutely replicates a natural process is still a challenge on the road. Now, coming to different applications of nanomaterials, as you can see that in the preventive dentistry, metal nanoparticles are used, inorganic salts are used, which applies like a functional approach to treatment where the root cause of the symptoms in primarily treated. So dental experts, they have emphasized prevention of tooth decay by inhibiting caries through controlling biofilm, by enhancing remineralization or providing antibacterial prevention. So now these nanoparticles basically, they provide high surface area to volume ratio, enable robust drug or drug combination loading that results in synergistic anti-biofilm efficacy. Now coming to tooth restoration, where we can see there was nanoparticles added in the composites, in the silver amalgams, and which exceptionally bettered their bondings, and they kind of lasted, the retention was quite well, and there was also a reduction in the net caries susceptibility too. We have already spoken about the endodontic process, where nanocomposites enabled the odontoblast stimulation and had a net good prognosis of the root canal outcomes. In case of prosthodontics, implants were significantly improved with this nanoparticles, because the implants nanotechnology played a vital role, and nanomaterials, they have been quite utilized to cover the untapped area of prosthodontics as well. So implants, in fact, implants was coated with hydroxyapatite crystals. They were coated with nano particles like bioactive glass, etc., including some bony scaffold like tricalcium phosphate, which we'll be seeing later as well. So which kind of bettered the osseointegration of the implant with the tooth. Coming to the orthodontics part, where nanoparticles kind of bettered the anti-biofilm properties, and that eventually resulted in a lot less complications once the orthodontic treatment was started, and the results of the net alignment of the tooth got a lot better. Coming to periodontology, where bone regeneration has a major role, and dentinal hypersensitivity is actually one of the major concerns which patients actually face with in periodontal diseases. So drug-loaded nanoparticles are scaffolds are becoming interestingly popular in tissue regeneration and healing periodontal diseases. Then biodegradable polymers like polylactic acid, glycolic acid based nanoparticles were successfully formulated to basically, deliver therapeutic actives like minocycline to show sustained release patterns in periodontal infections. So these are the few nanoparticles. Dendrimer, as you can see, they're primarily they created an antibiofilm against Streptococcus mutans, helped in remineralization. Then there was solid lipid nanoparticles, which helped in antimicrobial potential. They had helped in reduction of caries. Then, of course, regulating antimicrobial effect against S mutants. Then we have the chitosan nanoparticles, which also had antichoriogenic potential. Controlling dental plaque, works as a binder, remedy for secondary caries, improved mechanical properties of composites. Silver nanoparticles, noticed on size and stability of nanoparticles, modulated the temperature, significant anti-proliferative activity and antibacterial activity. Now coming to the future of nanodentistry. So basically, these are the primary aspects which needed to be talked about more often. First was the 3D printing, where recently Shao et al, their group, basically, they fabricated vancomycin releasing polycaprolactone, which we will eventually see in my future slides. Where they have used nanohydroxyapatite, this NHA's nanohydroxyapatite. They have infused nanohydroxyapatite crystals into nanocomposites, and they have tried to create dental restoration, keeping the three-dimensional restoration in mind. Then there needs to be more research on nanobots, which will carry out different program penetrations. Specifically, it would be a lot more helpful in the case of dental implantology. And of course, placing composites using a 3D filling technology so that there is a lot less initiation of secondary caries, and there is a good amount of sustainability for the dental composites in the near future. Then we have is the nanozymes. Nanozymes is basically the DNA nanozymes, which biosenses the presence of harmful dental bacteria. So Huang et al, they presented some biofunctional nanoenzyme, which inhibits this main pathogen, which is responsible for creating dental caries in our mouth, which is the streptomutans, but not the commensals ones, of course, which is helpful for us. And of course, they also go work against streptoorales using those iron oxide nanozymes so that it can break it down into healthier levels. Now, concluding the first topic, as we know that conventional dentistry is enriched by revolutionizing nanotechnology, and there were although many irrefutable lacuna which limits its clinical exploration, so that needs to be figured out. So how to transgress more of that research from laboratory setup to a clinical setup, of course, under economic prices, is also a legit concern. Research in the field of nanodentistry is still lagging in comparison to the other biological research areas, like nanotechnology has been significantly active nowadays in the medical fraternity, unlike the dental fraternity. And of course, patient-centered research will a lot more boost the development of nanotheranostics, which is therapy using nanoparticles. Of course, as I mentioned, it should be not only be efficacious, but at the same time should be affordable to the common mass. Now I will be dealing with the second topic of the my webinar, which is bioprinting in dentistry. Now, what do we understand by 3D bioprinting is? So basically, it's a major advancement in additive manufacturing, facilitation, and fabrication of complex 3D structures, which is able to incorporate living cells, biomaterials, and bioactive molecules. Now, they usually as you can see here, biowings. So they are basically formulations of cells. Dr. Rim Kalala's voice is, it has been unmuted. Anyway, So having said that, as we know that bioinks, as we can see here, so different living cells are along with this are polymerized and they are converted to bioinks. So they are basically formulations of cells, growth factors, and hydrogels basically, which is deposited in precise layers, to construct a intricate tissue architecture. So it displays, this figure displays the construct of a 3D bioprinting, which includes a scope of covering materials, processing, and application. So the printing process basically involves several key steps like preparation of the bioink, as you can see here, then to replicate the extracellular matrix. Now this extracellular matrix can be prepared using three of the methods, which is, first we can see is a inkjet based method. Then we have the extrusion based bioprinting and the laser based. Now, inkjet bioprinting is basically the traditional one, where they use thermal or piezoelectric or electrostatic force to deposit bioinks layer by layer. So it gives us a lot more high resolution, good cell viability, and of course cost effectivity. But the limitation is low viscosity bioinks. They prevent the nozzle and it clogs it, and it is difficult to use it for larger tissues basically. But in spite of its negative cons, it is still widely being used for skin, cartilage, and vascular tissue, even for those tissue models which we see in pharmaceutical industry for drug testing. Now coming to extrusion based bioprinting, EBB, where we see a continuous stream of bio ink via mechanical or any pneumatic pressure, which excels in fabricating large-scale mechanically robust tissues and scaffold. It is able to handle a wide range of bioink viscosity, which makes it suitable for creating larger construct like bone, cartilage, organ scaffold. But it has a lower resolution than inkjet or the laser-assisted one, and it can create a lot of high pressure, which kind of damage the living cell. But when we come to the last one, which is the laser-assisted one, it uses basically a pulsed laser to transfer the bioinks. Now it allows intricate tissue structure through a, allows the, construction of an intricate tissue structure through a process called laser-induced forward transfer, which is also called as LIFT, L-I-F-T. So they offer high precision, they reduce the clogging part, they minimize cell damage, but the major con is that is very expensive and requires a very, very careful control of the bioink composition. And it is mostly used in your neural, skin, and vascular structures. So as we can see here, it creates a bubble layers, and you can see the different modalities of extracellular matrix laying. So this we can see is AI technology, how it is, they use the 3D printing method. So layer by layer it is getting added, as you can see here, all the layer by layer process is on. So here is the fibrogen concentration is being created here. And this is a cone beam CBCT, which is being studied with using bioprinting, which kind of helps a lot in proper resolution and gives us a lot more better image quality and gives a lot more better accessibility to gauge a proper diagnosis, proper treatment planning for be it any prosthodontic purpose or any orthodontic purpose, and even for maxillofacial constructs as well. Okay, now coming to this part, as you can see here that this is basically a study which was conducted by Liu et al. So he incorporated deep learning 3D printing technology for dental model. So here we can see dental models and crowns, of course, that intelligently identifies and processes dental crowns and necklines. Now by integrating this technology with 3D printing, they achieve precise reproduction of dental models, which reduces labor cost and of course enhances the efficiency of the dental restorations. So there was also another study by Taheri et al. In 2018 actually. So where they studied mechanical properties of 3D printed dental material and demonstrated that the elastic modulus of these materials is comparable to traditional crowns and bridge acrylics and made them suitable for temporary dental repair. Now, what we see here is in the second image is there is something called as the PCL or the uh, extrusion-based polycaprolactone. So this study was done basically by Cho et al., who developed an extrusion-based polycaprolactone scaffold. And it was loaded basically with polylactic glycolic acid, which contained bone morphogenic protein 2 and bone morphogenic protein 7, and of course, connective tissue growth factor. So when they were implanted in a cementogenic osteogenic environment on the root surface of human teeth, the scaffold demonstrated dentin surface recovery after 6 weeks with BMP2 and BMP7, which aided in promoting the new tissue formation and integration. In the second, in this image we see is this was a study which was conducted by Dubey et al. And they basically what they're trying to do in this image here is create a bioactive membrane for guided bone regeneration using the MEW technique. MEW is melt electrowriting, where high voltage electrostatic field is used, and in a very controlled aspect, the surface matrix is laid down. So that is what it is primarily about when it comes to MEW. So they created a mesh and they loaded it with a hydrogel, and of course amorphous magnesium phosphate was there. This design delayed hydrogel degradation, prevented soft tissue invasion, provided a mechanical barrier, promoted bone regeneration, of course allows slower migrating progenitor cells to participate. So here what we see is here the bone regeneration technique, where tricalcium phosphate was used, with bone marrow derived mesenchymal stem cells and hydroxy active or bioactive glass nanoparticles, which had demonstrated greater osteogenic potential as measured by alkaline phosphatase activity. So they use this inkjet 3D printing to fabricate this calcium phosphate scaffold, which is the CPS here, the calcium phosphate scaffold. So they demonstrated good osteoconductive property and were kind of degraded naturally without any adverse effects. So this image is basically a 3D, three-dimensional picture where we see that a lot more convolutional neural network was utilized, and how localization of errors of dental arch in rotational panoramic or OPG was noted, which also gave us a huge edge in planning treatments when it came to prosthodontics, maxillofacial constructs after any major maxillofacial defect caused by any oral cancer, tumor, or trauma. In fact, for orthodontics as well, it gave a huge edge in planning the treatment and, of course, diagnosing without any artifactual error. So as you can see that we talked about previously about the scaffold part and how the mandible was constructed three-dimensionally so that it really aided in dental restoration. Then here we talk about 3D printed hybrid microtissue, which played a huge role in case of oral cancers. So as you can see here, these are all dysplasia, which is indicative of oral cancer. And this is how a machine learning model looks like. These are like the different steps to it and how it is applicable to creating a lot more developed treatment modalities and diagnostic modalities, which all these research are still under progress. They really help for pulp tissue engineering, Then they help in 3D printed drug loaded microspheres. So they all primarily involve bioprinting and of course convoluted neural networks. So these are the basic progress which they have achieved is, cropping around the region of interest here, then which really helps in the image augmentation part by, enhancing the whole contrast. So when the image itself is getting augmented using such neural networks, deep learning and three-dimensional structures using bioprinting, so automatically the net monitoring a disease progression, planning a treatment protocol, gauging the outcome, planning a personalized care for any patient undergoing any form of treatment becomes a hell lot more easier. Now, coming to the major con of this bioprinting is that although a lot of research has been going on, but getting passed through those ethical and regulatory guidelines is one of a concern, because a lot of clinical trials are ongoing, which makes all these treatment protocols, some have been improved, some have been approved and is on the way, like we have seen it for in case of some dental restorations. But most of the others which involves these major treatments, like covering a defect in maxillofacial surgery, or implants, or planning an orthodontic case, for such cases still a lot of clinical trial has to be done on human models. A lot of ethical issues needs to be taken care of. A lot of regulatory guidelines have to be met as per the CDSCO records. Then most important is getting past is one thing, and implementing them into clinical practice is something, because just because something looks good on pen and paper and in research doesn't mean that it will be actually implemented, although some has been implemented. But when we are looking at the broader aspect of research when it comes to bioprinting and nanotechnology, a lot has still to be discovered, because the real world data has to corroborate with the commercialization, which means that the people should be able to accept it. The cost of the treatment should be affordable by one and all. It should not be made accessible only for one class of the society. It should be made accessible to one and all. So in that case, commercialization and diversified applicability, most importantly is the ability of people, ability of the dentist, ability of the different specialists to incorporate, to be able to afford those infrastructure in their clinics is also a question that needs to have its answers. And coming to the broader aspects, when we see that such education in terms of nanotechnology and 3D bioprinting, deep learning, then this convoluted neural networks, they need to be implemented in the basic BDS curriculum, the basic dental graduate curriculum, so that since their very inceptional days, so that the students do have an idea, so that these students can go up to and create miracles, and they could probably give their share of effort, their share of opinion, and their share of research to make this happen in the broad daylight. And of course, the research does not stop here. So whatever research has been done, whatever has been implemented yet, a lot needs to be undergone, a lot needs to be implemented, and of course, a lot needs to be sharpened and honed upon, so that it just doesn't stay here, so that cure to dentistry can be so that people have a lot more knowledgeable approach towards it, a lot more innovative, or the avant-garde approach to the dentistry, as we mentioned before. Now coming to the conclusion part, so basically 3D bioprinting, they help in precise design of and fabrication and prosthetics, tissue construct. Then by incorporating such biocompatible material, they offer potential to regenerate teeth, gums, bone structures, thereby addressing critical needs in treating complex dental condition. And of course, as we know that when it comes to diagnostic process and treatment planning, AI significantly reduces human error, which helps in decision making and bettering the treatment outcomes. They also promise to redefine dental care by improving accessibility, reducing the procedural cost, enabling highly individualized therapy. As I said, that every patient is different, every diagnosis is different. Just because two patients have two similar diagnosis doesn't mean that they should be treated in the similar pattern. So in such cases, AI-driven dental care, 3D bioprinting printed and nanotechnology-driven dental care helps a lot in personalizing the treatment outcome, the treatment protocol, the planning methods, the diagnostic modalities to be used, everything that will undergo in that total workflow. Of course, the procedural cost has to be taken care of, and of course it has to be seamlessly to be merged with the existing clinical workflows. And of course, lastly but not the least, it paves a way for the future where regenerative technique and AI-based methodology becomes a usual norm in clinical day-to-day practice, and they will be able to offer us unprecedented opportunities to improve the patient's quality of oral health care. So these are my bibliography.